Hello, my wonderful learners. I hope you all are doing well. So, let's get connected to Dr. Reena's Physiology Core Crisp. And today we're going to have an interesting MCQ session. So, before I take the MCQ, just make a request to share the channel as much as possible. Please ensure that you comment, you like. This is the Telegram group, and on the Telegram group, as you know, I provide free notes of whatever classes I take, right? So this physiology is my passion. So let's get started. Now there is an MCQ saying that a 25-year-old medical student eats a fast food meal which has got cheeseburger, french fries, chocolate shake, and this meal stimulates the release of a hormone that is secreted by the duodenal and the jejunal K cells in response to carbs and fat digestion products. So which is this hormone likely to be? Cholecystokinin, gastrin, GIP, that is glucose dependent insulinotropic peptide, whether it is motilin or whether it is secretin. Now, coming to the discussion, as soon as you get an idea that when the diet consists of fat, it consists of carbs, and also it consists of some amount of protein. So there is a mixture of these three products. First hint. Second hint, it is coming from the K cells. So without any confusion, the answer will be GIP, that is gastrin inhibitory peptide. So it is your gastric inhibitory peptide, which is also called as glucose dependent insulinotropic peptide, that is it is also called as an incretin. So this is the extra edge of this hormone. So the main function of this hormone, that is GIP, is to inhibit, that is to decrease the gastric motility as well as the gastric secretions, right? Apart from this, another very important function is that it brings about an increase in the level of insulin. So one of the factors that is causing increase in the insulin is GIP. This leads to me to tell you something very interesting. Suppose there is a patient, you gave IV glucose, right? And there is a patient, you gave oral glucose. So एक patient को आपने drip लगाया, एक patient को आपने oral दिया. My question is, which of these patients, A or B, will have more release of insulin and why? So think. This is the answer. The person or the patient which will have more insulin secretion will be the person who has been given oral glucose. What is the reason? When you are giving IV glucose, definitely this glucose will be coming into the blood, and obviously it will bring about directly the increased insulin from the beta cells of pancreas. But when you are giving oral glucose, you are not only rising the blood level of glucose, which will directly cause the release of insulin, but this glucose is going into the GIT, and in the GIT it will be secreting GIP and various other hormones which will also cause increase in insulin. So with oral glucose, directly insulin secretion by the beta cells of pancreas and indirectly insulin secretion throughout the GIT hormones. Therefore, oral glucose results in more insulin secretion. This is a very important logical and conceptual understanding. If you look onto the other hormones, right? If you look onto the other hormones, remember, cholecystokinin is by the eye cells and also triggered by fat and protein, but it is secreted by the eye cells. Gastrin is mainly by the products of protein digestion coming from the G cells. Motilin secretion is largely because of the presence of the food. It is not exactly known which food will secrete motilin, because it is secreted by the MO cells or the enterochromaffin cells, and it is responsible for MMC, that is migratory motor complexes, which are nothing but the interdigestive movement. So it is not taking a plate in digestion, but in interdigestive movements. And finally, you have got secretin by the S cells, which is stimulated by products of fat digestion, by acid and also by protein meal. And the most important function of secretin is to neutralize the acidity and augment the action of hormones like cholecystokinin for the protein and fat digestion. So this is all. Please ensure you share, like, subscribe and get the notes. Thank you and God bless you all.